If you're telling me you know the farm and you can't differentiate the list, you don't know the farm. And that's a tough love I want to give you guys. All right. So keep pushing hard. My advice, Dr. Maroni, because it's challenging. That's why we're here live helping each other out. But you could always reach out to me, email, instant message me on social media, or ideally, because you're part of my family here, my system, email me, go through the community. Any questions you have, there's no reason that either myself, my team, or my students can't answer, because that's why you're here. I don't want you to be out there getting information, because there's a lot of info out there. I just don't, I have no way of auditing what you see out there. Here, I can audit everything and make sure all of you have the best advice for you. Advice that I provide is general advice that helps the majority, but everyone is different. Some people can't study 7 hours a day. Other people can only study 2 hours. Other people need more review. Other people, the memory isn't as strong as they thought it was. Others have great memory, but they have poor test-taking skills. There's different variables that we all have that we have to take into consideration. So that's why I love all of you to jump on, to help me out so I can help you more. The more advice, the more you give me feedback, the more I can give you advice. Yes? Yes. All right. So I'm going to do some questions here. And again, I just do this so I can get you guys fired up. Because for example, right? Example, ladies and gentlemen, check this out. Look at this list of drugs. Now, you might say, Stavros, come on, man. This is easy. I know these drugs. Okay, fair. Do you know all the drugs? Because if you want to do well on any exam on STEP, you should be focusing more on things that have immediate results. Meaning, don't put all your energy on learning anatomy and concepts that you already had to have learned in med school. This is literally easy points, because now you say, well, I have doxy, metro, levo, clinda, azithromycin, piperacillin, and ceftriaxone. I know you know them all. I know you're familiar with them. Do you know all of their MOAs? You don't have to answer me, answer yourself, right? Either you do, you don't. And do you know any adverse effects on them? You should. If you don't, shame on you. Meaning, not shame on you if you started studying. If you've been studying for a while, you tested less than 2 months, you should know all of these. Now, did you ever hear me ever say you should know the brachial plexus? No, you should, but I don't know it sometimes. I forget it all the time because it's not points for me, right? It's anatomical. I know the branches, but this, they could ask you treatment, ask you what it does, adverse effects. So watch this, ready? I'll read the scenario. Now, all of you watching here, a lot of you are watching this recording later because you're in school. So hi to all my doctors and students in the Caribbean and overseas. Other people are sleeping now because of time zones. So hi to you. Look at these answer choices, right? 1, 2, 3, 4, 5, 6, 7. Look at the length of question. This looks just like an NBME. That's it. This is literally NBME question, meaning the look of an NBME question. The actual exam is going to be a lot longer. So when you're doing NBMEs and people tell you to memorize NBMEs, yeah, it's great. The actual USMLE is nothing like this. So when you're used to reading scenarios this long and the step is this long, my friend, you're going to get exhausted. So be careful. All right.